are from what we're calling the Lakemba GP cluster, and the other 2 are from an existing cluster. But can I say this, and I say this based on the advice Dr. Chant has given me today in the presence of Minister Hazzard, that following our meeting this morning, what we call our State Emergency Operations Committee overseeing COVID, our state is on the verge of being where it was when we had the first seeding incident from Victoria. And I want to be very clear about this. There are a number of locations in southwestern Sydney, a number of people who need to come forward and get tested, and it's really important for everybody to note the information that Dr. Chant is going to give. I will also say that yesterday we announced the easing of restrictions in relation to outdoor hospitality venues to 2 square metres instead of 4, and we still think that is a prudent decision. However, I do also want to say that today the government was intending to announce further easing of restrictions in hospitality and that today the government was also intending to ease restrictions in terms of hospitality.
Okay, so we're having a few issues with that link there with Gladys Berejiklian at the moment, but just some interesting news there from...
Tomorrow you will see the impact of COVID on further job numbers, and we did want to send a strong message to the business community that notwithstanding what those figures may be, that we have confidence in the future of our state economy and in keeping jobs. Now, we'll closely monitor what those jobs numbers are tomorrow and act accordingly, but from a health perspective, I want to make this very clear, that we had intended to ease some further restrictions, but we'll be holding off until Dr. Chant gives us the green light to say that we're over the existing current concerns. And I want to make this very, very clear. We did have 16,000 tests overnight. We had 16,000 people come forward and get tested, but that is not enough under the existing circumstances, and Minister Hazzard will explain further why we need more people to come forward and get tested at this time. I cannot stress enough that this is the most concerned we've been since that first incident when the Victorian came up, infected his colleagues and then went for a drink at a particular hotel. So this is the most concerned we've been since that time. And again, we're urging everybody, in particular in southwestern Sydney, in Western Sydney and other locations which Health will advise. And overnight, whilst it's not included in today's numbers, we have had a case in Bargo, which is slightly, again, further out the fringe of Sydney. So I really, really appreciate everybody's attention to COVID-19 and what it means for New South Wales. If we get advice in the next few days to say that Dr. Chant is now satisfied that we can make those announcements we're intending to do, we will. But I want to make very clear that we're holding off because we are concerned with where we're up to. So Dr. Chant now will give her detailed update. Minister Hazzard will give further information on testing, where you can get it done and why it's so important at this time. And then obviously we'll be open to any questions. Thank you.
So New South Wales reported 11 new locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and 3 cases in overseas travellers in hotel quarantine. Of the 11 locally acquired cases, 9 of the new cases were linked to the Lakemba GP cluster, which now has a total of 12 cases linked to that cluster. All 9 cases are household or other contacts of known cases, including 3 who attended the clinic. Contact tracing and investigations into the source of the cluster continue. And the other 2 cases are similarly linked, and they're linked to the private clinic cluster in Liverpool, which now has 10 cases in total linked to that. 1 case attended the clinic and the other is a staff member at the clinic. Investigations continue into the source of that cluster. And one of the new COVID cases reported today attended the Narellan Town Centre on Camden Valley Way on the 7th of October from 11:30am to 1pm. And everyone who attended at that time is considered to be a casual contact. So again, please, if you develop any symptoms and were present at that location at that time, in particular, go forth and get testing and isolate yourself until you've received that negative result. As the Premier indicated, overnight we did receive another notification of an elderly gentleman from Bargo. The interviews are still underway with that gentleman, but in order to galvanise the community, we are identifying that case ahead of more formal details of their movements, to ask the community to be particularly alert in that Bargo area and present for testing. As the Premier said, we are in a critical phase. It's reassuring overnight that the cases were linked to known clusters. Obviously, overnight, we're investigating a couple of other cases that we will need to do that investigation to see if they're similarly linked. But I suppose due to the large nature of the contacts that we've had to do, the multiple venues, all of that means that there is potentially infectious people in many settings. We're still trying to unravel the source of a couple of the clusters, and for that reason, this is a time that we're really asking the community to come forth and get tested, but also maintain those COVID-safe practices. Thank you.
Thanks very much, Kate. Look, it's fair to say that as Health Minister, I have some concerns, some very serious concerns about testing. The numbers that we got overnight are just reminiscent to me of Crossroads, and it worries me that perhaps the community are not actually coming out in the numbers that we need to be tested. Effectively, each and every one of us, our community, are the troops, the frontline troops of a war on COVID. And just thinking you might have hay fever is no excuse to not go and get tested. In fact, it's the reason you should get tested. So what we've seen in the last few days is the numbers of testing on Monday get down to 7,000. That means that on Sunday we had not too many people going and getting tested. I really am making a very strong call to our frontline troops, our community in this war on COVID, to go and get tested. Any symptoms at all of a flu-like illness, or you might think it's hay fever, you might think it's some other very minor illness, but you need to go and get tested to keep us all safe. Keep yourself safe, keep your family safe, keep the community safe. Now, the numbers overnight, just over 16,000 to 8 p.m. last night. That's getting there, but it's not there. We're looking for numbers now, particularly as we're seeing this increase in community transmission, upwards of 20,000. So please go out and get tested. Don't feel guilty about getting tested. That's why we have available facilities, pop-ups, hospitals, ready to have you come in and be tested. Now, the gentleman in his 70s that Dr. Chance has talked about is obviously in the Bargo area. So I just want to remind the community in the Bargo area that you've got a number of different facilities. You've got Camden Hospital, you've got Bowral Hospital, you've got Campbelltown Hospital, and of course you've got the Oran Park pop-up. Oran Park pop-up, by the way, is fairly busy today, which is great. So perhaps head off to some of the hospitals that are available. But don't feel guilty. Go and get tested if you have any symptoms, because if you do that, you're keeping us all safe. And we really need that in the next few days and weeks. As the Premier said, we've had discussions this morning again at the Crisis Cabinet about what we might be able to free up, and we're keen. The government is very keen to free up and make the community go even further back to the pre-COVID normality. But we can't do that. We just cannot do that. I, as Health Minister, can't recommend that. Dr. Chant can't recommend that until we get a hold of this particular latest number of people, particularly as Dr. Chance has talked about. But we are keen to move forward. We need the community to be with us on that journey.
Dr. Chance, if I could ask, some of these areas, look, Canberra in particular, a very linguistically diverse area. The census says 80% of households speak a language other than English. What is New South Wales Health doing to reach those people who may not be speaking English as their first language?
Well, I think this is one of the strengths of our response. We recognise the fact that we need to engage with a very culturally and linguistically diverse communities, particularly in southwestern Sydney and western Sydney, but all parts of Sydney and even New South Wales. We work from the outbreak. There have been certainly some people that have come from other countries impacted by this, and we've made sure that there's been targeting of messages, particularly to those community groups. We've also looked at leaders in the community, how those groups come together, who they look up to, who do they seek advice from. So, for instance, we've recognised the key role of obviously religious leaders. We've also worked with local government mayors and also through GPs, particularly the many people access GPs that speak speak and are of the same cultural background. And we communicate in a variety of different ways through social media, targeting message translated. And we thank everyone for reaching out and assisting us with that.
Dr. Chan, do you know how many people, how many patients these two doctors have seen during this infectious period? Secondly, how did the doctors get the virus in the first place?
Those investigations, as you can imagine, it takes quite a bit of forensic looking back to go back to the index source. We still are not at the absolute index source, and we're investigating a number of lines of inquiry, but we do believe that there is potentially a link back to a GP from southwestern Sydney as a source. But again, we hypothesise there may have been a patient that they saw, but it's too early to speculate. I think the key element here is how these chains of transmission can cross over geographical areas, and how it is so critical that we detect these chains of transmission at the earliest possible point.
Do you have a number about how many patients that may have seen?
So in the practice, I know we can update you on how many people we've contacted in the practice. There's a couple of days we're particularly concerned about in terms of transmission, but overall there are many hundreds of patients that we are contacting and reaching out to associated with the practices.
A number of restrictions that were announced yesterday, announced yesterday, come into effect on Friday, like the 1 for 2 and the 1 for 4 outside. In your medical opinion, given what we've seen overnight, too soon, or should it be revisited that Friday coming?
I think one of the elements of this is it's very important that we try and create sort of a rational set of restrictions in place. And I think the movement towards acknowledging the important focus on music rehearsals, we've said to the music industry and various music bands that it's actually safer to practice outdoors. And really what that was about is enabling that practice to occur. So it's actually about moving them from indoor venues outdoors in a very similar way and requirements to the requirements around community sport. And in essence, tighter restrictions in the sense that the people are required to be seated whilst not performing. And so I think that part of our response to COVID has got to be about bringing the community along with us and doing that in a COVID-safe way. And I think that announcement strikes that balance.
Dr. Chan, we've got a couple of very big events coming up, like the Everest Cup, football games.
At this time, there's been extensive behind-the-scenes planning. We've actually had public health officials at a number of the lead-up games in terms of some of the events. And we've really learnt with the sector about the controls that need to be put in place for those events. Obviously, it's about implementation, and I would call out to any community members going to those events, please follow the advice that you're getting given. If you're told to maintain your social distancing, please do so. For some of those events, you'll be told to apply your mask when you're not seated. Please do so. I think this has to be a shared responsibility, and if we are going to continue to ease restrictions, and that's an important component of us learning to live with COVID, I think it is a responsibility of us as individuals and a responsibility of business and for government to work together.
Premier, just on easing restrictions, you said in your opening statement you had indicated that there was going to be some easings announced today, but that's decided to go on hold. Can I ask what you were going to announce?
Certainly. Without getting into too many of the specifics, we were going to further ease restrictions in relation to hospitality venues and potentially how many you can have in a group booking and those type of matters, and how we address smaller venues. So obviously at the moment you're still limited to only 10 for a group booking. So I will foreshadow that we were looking at those numbers. We were looking at what we do with smaller venues, because some smaller venues are saying, well, the 4 square metre rule is killing us. So can you have a minimum number before you start counting the 4 square metre rule? So they were the things that we were going to be able to announce, and I'll be very open about that and would like to still be able to do that, but as soon as Dr. Chant gives us the green light. So what my urging is to the community, please, if you live in those areas which have been identified, if you have any symptoms, please get tested, because the more people that come forward and get tested gives us more confidence that we can move forward with further easing. But at the moment, the number of tests, they're getting up. They're around 16,000, as Minister Hazzard said. But given the risk that's posed at the moment, we really do need that number hovering around 20 to be able to be confident that we're capturing all these cases, because some of the new cases that have emerged in southwestern Sydney tells us, and Dr. Chan explained this in great detail to me this morning, tells us that there was some chains of transmission we hadn't picked up weeks or months ago, right? So they're now emerging in different clusters in nearby areas, and it's really important for us to make sure that we're not missing any of those chains of transmission, that we're picking that up, so that in a week's time or a couple of weeks' time we suddenly don't have 20 or 30 cases that pop up which we haven't managed to identify, and that's why that's really important. I can also foreshadow that we were also looking at the number of people that can attend weddings, so long as they're seated, so long as they follow those health rules. So they were the suite of restrictions that we were in a position to be able to say something about. But I'm still hopeful that we can say something about that in the next little while, so long as Dr. Chant has the confidence, and so long as Minister Hazzard said, more people come forward and get tested. But what we know now is there were some chains of transmission we may have missed. That's not a concern, but it's to be expected, because every day that we've come out, we've said we suspect there are cases out there that we haven't picked up on, and that's proven to be the case. But I still want to commend all of our health experts, the police and everybody else who are helping coordinate that activity. And I'm confident we'll get on top of this as well, but we just have to be sensible. I always said in New South Wales back in February, March, when the seriousness of COVID became apparent, that I don't want us to ever be in a position where we go backwards, and we're not. At this stage, everything we have in place, we feel confident we can maintain, including the 2 square metre rule for outdoor venues from Friday, because that in effect affects mainly CBD venues and not so much suburban venues. So we're still comfortable with that, but should the health advice remain concerning in the next few days, we won't be able to make further restrictions, because for me it's really important that we don't know what tomorrow's job numbers are going to be. They could be really terrible, it could mean we're holding, but either way we want people to have confidence in New South Wales that the government is really, really preoccupied and concerned to make sure that job security, creating jobs, is our priority. And I want to commend Dr. Chant and Minister Hazzard. Whilst they both deal primarily with health issues and containing the virus, both of them are very open to making sure New South Wales, and I thank them for that, they're actually in some places more courageous than I am, in making sure we get the right balance between health and the economy. And that's the path, the balance that we've been trying to strike, and that's the balance we'll continue to strike. But I have been very open in terms of the kind of issues we were looking at in terms of being able to announce. I'm not going to rule out we won't be able to announce those even as early as later this week. However, it will depend on what happens in the next few days, and I'm really urging everybody, please come forward and get tested. We know it's annoying. For some of you, it might be your 3rd or 4th test, but please do it. We're making it easier for you. The pop-up clinics are there. The extra clinics are around the place. I have lots of people who I know having the test text me to say only took 12 hours or 6 hours or a day to get the test results back. Please do that, because it means all of us then can keep moving forward. And I want all of us to be very positive about the summer. I want businesses, individuals, when they're planning their Christmas holidays or planning their Christmas gatherings with family and friends, we want people to have certainty around what that means, and that also gives a boost to businesses who can plan to cater for what they might think it's going to be like. And ironically and interestingly, it's probably safer for people to have a Christmas lunch at a hospitality venue rather than at home, because you're more likely to get the virus inside the home than you are outside in a controlled environment. We're very conscious of that, and that's the fine balance that we're trying to strike between now and that season.
They're listening to our numbers and seeing what's going on. November 1 is probably fine as guys.
Well, I think I suspect the Queensland government will have a different attitude to a whole range of things on the 1st of November, and I'm still hopeful, because whilst people are very, very optimistic about the vaccine, I'm not a health expert. But we have to govern as though the vaccine is a while away. And I don't want to dampen anybody's hopes and aspirations. But what I do want to say is I think in New South Wales we can live a very normal, healthy, COVID-safe lifestyle, and businesses can keep employing and people can get jobs and reskill so long as we keep that balance. And I say to the other states, please look at our resilience and the balance that we're able to have in New South Wales. And I hope that by putting down their borders, because I can assure you those tourism operators in Queensland will go belly up after summer. I mean, it might be okay now and there'll be elements, and I don't want to take away from the Queensland Premier, who knows her community much better than I do. But what I do know is businesses can't survive successive tourism seasons with no customers. Airlines can't survive when people don't catch planes. It just doesn't work, and jobs can't survive. And I just say to the other state premiers, WA and Queensland in particular, please think about that. It might not hurt you now, but it will hurt you in a few months' time. And we know the pain and hurt people are going through. As I say, I'm constantly overwhelmed by the stress that I feel members of the community are under at the moment. It's built up over some months, especially if people have been separated from family, especially if you've worked on a business for years and then had to let your staff go that it may have been with you for years and years. Now they're painful decisions people are making. My job and the government's job is to reduce that stress, to reduce that burden, and I just ask the other state premiers to think about that because it plays on my mind every day.
Premier Darren Maguire, he was the Executive Director of Gateway International Airport, supporting a company that sold access to the highest levels of government monitored services. And he said that he was the person who had access to the highest levels of government. What access did he have during your relationship?
Can I say this? And with all due respect, I've answered every question I've been asked the last few days. I've been very open about issues that are very uncomfortable to me, issues I don't talk about. But I will say this, every day that I'm in this job, I am here for the people of this state. Never ever have I done anything wrong in relation to my position. Never ever have I tolerated anybody else doing anything wrong. And if I ever saw it or witnessed it or knew about it, of course I would have taken action. But I say this to the people of New South Wales, can I thank you? I have been honestly overwhelmed and sustained by the support the people of this state have shown me in the last few days, and I will repay that by continuing to work for you, to be your number one advocate, to keep you safe, to keep you employed. That is my job. It is my honour and privilege to do it every day that I come to work. And my message, excuse me, let me finish. Okay? I've given you your turn for the last 3 days, let me finish. And I say to the people of this great state, you elected me, you deserve me to be focused on you, you deserve for me to be focused on the issues that matter to you, and that is exactly what I will do. I know the people of this state know that I've done nothing wrong. I never have and I never will. And I appreciate the questions you all need to ask, and I've answered them in full detail over the course of a number of days, but you also have to respect my position as Premier and let me do my job.
This is new information.
Right.
He said that he had access to the highest levels of government to promote his business dealings. What access to the highest levels of government did he have during your relationship with him, during which you told him Monday had hundreds of thousands of conversations with him?
Respectfully, that's not new information. And I say to you, refer to what I've said in the last few days, and I say this. There is clear separation for all of us, no matter who any of us are. There is clear separation in what we do at work, what we do in our public life versus what we do in our personal lives. And I am more conscious of that than anybody, than most people would ever appreciate. And I say to the people of this great state, I apologise for the distraction. It was out of my control. I apologise for that completely. I never have and never would do anything wrong by the people of this state. I am here for the people of this state. I've been overwhelmed by the comments and the support I've received. And whilst I will always be open and transparent in answering every single question I receive on any matter, I also appreciate the need for me to be focused on my job. And if I had done anything wrong, I would not be standing here today as your Premier, and I want to make that very clear. I would be the first one to admit if I'd done something wrong, but I have not. And what I want to do and continue to do and will do is put our people first. The most important thing for me has always been my service to the community, my service to the public. That is unwavering. And I will not have innuendo, incorrect statements put to me, which I have found offensive, but in due course I have accepted to answer everything because it is in the public interest for the public to have confidence in me. And that's why I've been very, very open about things that are very difficult to talk about, things that I don't talk about even with the people closest to me. But I have done that because the public deserves to know they have a Premier who knows the distinction between her personal life, even though she's stuffed up in it, who knows the distinction between how important her public office is, and who also knows that every minute of my day that I'm at work as the Premier of this state, which is 24/7, I'm here for the people of this great state.
Did Darren have access to the highest levels of government promoting his business during his previous relationship, which he claimed today?
I have stressed over and over again, I had no knowledge of any wrongdoing. And those matters have already been canvassed, and no doubt in the next few days will continue to be canvassed. I have made that point on numerous occasions, and if I had done anything wrong, I wouldn't be standing here today.
Premier, do you maintain the position that you gave in evidence in the IPAC hearing on Monday that you do not know or have not met Crown Group chairman?
Well, please use your words carefully, okay? Please use your words carefully. I say this, as Premier, I am in photos and meetings and whatever else with many people I do not know, with many people because of that is my role. My role is to conduct the affairs of state. My role is to be in positions where you are in photos and things with people you don't know and you don't put things together. That's the nature of it. But please be careful with the dots you're trying to draw, which simply do not exist. Simply do not exist. Okay, and I'm happy to answer all questions in relation to the public interest, but my tolerance for answering questions which frankly are offensive is waning.
How is that question offensive?
Because I've already provided information to the ICAC on those matters, and I refer you to that.
Premier, in respect of something that you told Parliament yesterday, you said that you would have reported something if at any stage I knew that anything was going to happen that was wrong. Given that your previous evidence to the ICAC that Mr. Maguire was a good talker, for a lot of the time is it true that by those statements to Parliament yesterday you would have reported something if you believed the business was talking about would have been successful?
Please, if I had any suspicion that any Member of Parliament, whether it was him or anybody else, was doing the wrong thing, using their office for the wrong purposes, I wouldn't have blinked. Of course I would have reported that. But this gentleman, this person had access to so many people, and the end result was nothing. He actually tried to get things done and he couldn't get things done because of everybody in high office, including myself, including my colleagues, including those noble public servants. And can I thank those public servants? Because that has instilled my confidence in the systems we have. Somebody who we trusted, imagine knowing someone for 15 years, someone who we trusted did the wrong thing by all of us, but he didn't get his way because all of us put our jobs first and put the people first. That's why he didn't get his way, because we put the people of New South Wales first. And I don't care who it is. If I suspect someone is doing the wrong thing, if they are not doing what they need to do in putting their communities first, no tolerance for that, and I can't stress that strongly enough.
Premier, it appears inevitable the Legislative Council will pass a motion of no confidence in you. Does that bother you? How does that sit with you?
Look, that is a matter for the upper house, and I will leave that to them, Lachlan, and see what they determine. And I would ask them to consider the facts, but that's a matter for them. And as you know, the upper house is hostile is not a nice word to use, but it's often described as hostile. The government hasn't controlled the numbers in the upper house. I'm also someone that's very direct with people in terms of where the government stands on issues, and I appreciate as a leader, sometimes I've made decisions which some of the crossbench don't like, whether it's the shooters, I don't want 10-year-olds to have guns, whether it's One Nation, I believe in tolerance and support our multicultural society. So I've been very outspoken on those issues, and I always will be. And if that's to my personal detriment today, well, that's fine. I won't change my position on issues that matter to the public.
Premier, some of your senior colleagues have raised concerns that your relationship with someone who was conducting business with Chinese businesses may have raised the prospect of you being of interest
to China? Just an influence. What do you say?
I say to that that's complete rubbish. And as the Premier of this state, I pass security clearances that nobody else has to pass, and I have access to information which assures me, which gives me assurance that what I need to be aware of, and I always adhere to that.
Security services aware of your relationship with the
Can I say that at all times I'm provided with advice on matters of a sensitive nature which enable me to do my job.
A number of times also that
I'm sorry, Maria, how can you continue to govern if you can't get any legislation through and a hostile upper house that may vote today to have no confidence in you?
That's really interesting. They said they would oppose all government legislation. Yesterday they actually passed government legislation. The electronic driver's licence legislation got through. So I'm happy to hear those comments. But when there's an important matter to come before the upper house, I would assume that colleagues of the upper house would judge those matters on their merits.
you've said a number of times, Mr. Premier, that you assume that they're required to make all the appropriate declarations and disclosures. Under the code, isn't he required to make those disclosures directly to you?
In certain circumstances, but not all circumstances, and they are kept with the department. They don't come to me directly. It depends on what it is. But I say this again. Please refer to my previous comments. Please refer to the fact of my absolute the integrity with which I hold this office.
What are the certain circumstances?
I'm sorry.
What are those circumstances?
Oh, they're on the public record.
But they wouldn't be related to his business dealings.
No, there are. If you look at all the different codes, there's elements on there which tell you who you have to report to at what time.
During his evidence as well, Darren Dwyer said that between 2012 and 2018, he used his office here in Parliament, public role, largely, not exclusively, to promote his personal business interests. Given you were in a relationship with him for such a significant amount of time during that period, how did you not know what he was up to?
Well, I would say this. When someone is in Parliament for 15 years and you trust them, I say all of my colleagues have been in the same situation as I am. If any of us had known he was doing that since 2012, if any of us had known that, of course we would have reported it. But obviously he fooled a lot of people. He fooled a lot of people because clearly he was conducting activities he shouldn't have, and many people were not aware of that.
Has he made a fool of you, Premier?
I'm sorry?
Has he made a fool of you?
That's for others to make judgment on. That's for others to make judgment on.
With respect to Premier, in relation to Alex's question, you said all of the people, all of the people in Parliament in relation to his office, would you have been in a better position to know what was going on in that office?
Premier, do you believe Darren Maguire's greed could be why? I'm sorry, I can't hear. Do you believe Darren Maguire's greed could be why he pursued a close relationship with you so that he could have that access to influence he's now admitted to seeking for his business?
Look, I'll let others comment on that, but what I will say was that in relation to me, in relation to my colleagues, in relation to the public servants that were involved, he got nowhere, notwithstanding his intentions. He got nowhere, and that is what's important here.
Premier, in regards to an email that was spoken about in your evidence and further evidence yesterday, an email sent by Ms. Rachel Waterhouse to your personal friend, your personal work email, was deleted. Do you have any recollection now of why it was deleted? And from a public policy perspective, do you think it's a good idea that someone can email the Premier and the Premier is the only person that has access?
Look, I made comment of that 2 days ago, and it's not an appropriate way for people to contact me. That's why I've said people have to come through the front door. I have no recollection. I get thousands of emails. Apparently, it was brought to my attention. I got 2 of the same email, and 1 was deleted. But obviously there was still an email around it, but nothing happened. No meetings, no doing anything. So I say this again. That I've been extremely forthcoming. I've been very open and honest in all the questions I've answered, and I stress again that at no time have I done anything but keep the people of New South Wales top of mind by making sure the people of New South Wales always come first. That's always been the case, and it always will be the case. Thank you very much. Thank you.